Good afternoon. I'm Brenda Ryan. I'm a nurse practitioner at the Hoag Heart and Vascular Institute. And today I am joined by Dr. Pezeshki, who's one of the cardiologists I work with.
Yeah, hi, I'm Dr. Pezeshki. As Brenda said, I'm a cardiologist here down in Newport.
And we just wanted to share with you some of our thoughts and feelings about heart disease and exercise. So Dr. Pezeshki, can you tell us what the effect of stress on your whole health and specifically your heart health would be?
So I think the first thing you have to define is what is stress. Because I think people define it in many different ways. There's sort of good stress and bad stress. There's people who lead stressful lives, but they thrive on that stress. If you look at, say, firemen or investment bankers or so on and so forth, they'll tell you their life is very stressful, but they really couldn't live without that stress. They really enjoy it. So if it's a stress that sort of gives them sort of the energy to live, then it's really a positive thing. But if by stress you're defining sort of a negative emotion, as in something that makes them feel bad, then I think perhaps there might be some detriment to the heart. But we don't really have, I mean, these are tough things to measure from a scientific perspective, to say how much stress causes heart disease. It's not so simple. It's not like, say, salt in a diet. We recommend 2 grams or less of sodium in diet a day, but you can't say how much stress somebody has in a day, or even define that stress. So it's difficult to answer it scientifically.
So even though someone has that good stress that makes them go, as I consider myself one of those people that's always on the go, is there any long-term lasting detriments to my health, or is there something I should do to maybe balance and counteract some of that?
Well, I think having a balanced life alone is important anyway. But the stress that, if you look at people who have heart disease, I treat a lot of heart attacks, and invariably heart attacks are a sudden event. It's like an earthquake or a volcanic eruption. The volcano was always there, but for some reason it seems to erupt at a certain time. So a lot of times you will see that the patient has had a recent stressful time. Now, stress from a biological perspective, the sort of, let's call it the negative stress, is associated with with hormones and a balance in the state and a biological state which is probably detrimental. Things people have heard of, such as high cortisol levels, high levels of epinephrine. If you look at heart attacks themselves, they seem to occur on a timely basis. There's a lot more heart attacks on Monday mornings, for example. There's less heart attacks in the afternoons on the weekends. Blood pressure itself goes up higher, is generally higher in the daytime, particularly early in the morning. And it sort of wanes and lowers in the afternoon and in the evening particularly. If you look at when people are happy, they seem to be happiest when they're home after work. Work itself for most people is not easy and is hard work. And that's really when a lot of the heart attacks seem to happen. That's when the blood pressure is higher. As I mentioned, the cortisol level is higher. So this is sort of this is part and parcel of modern human society. As far as your question of what to do about your stress, I mean, you can't just sort of get rid of your job. That's going to be more stressful if you don't work. Obviously, we work because we need to. We work for many reasons. We don't just work because we need the money, but we work because this is what we do. This is how we define ourselves, so on and so forth. What I think that people can try to do is frame their stress differently if they can, in that try to see sort of more positive things about the stresses that they have, the reasons that they work, so on and so forth, and perhaps with those it lessens the damage to the body itself. I mean, I think there's a lot of things that go along with stress, and I'm a clinician, I deal with patients, but the things, unfortunately, that we do as humans, particularly in modern life, to alleviate that stress, a lot of times are harmful, such as some people eat more, some people drink more, smoke, so on and so forth, and and do sort of bad habits to relieve their stress. And to bring it onto the topic that we're going to go on to later, I mean, I think that one of the great things that somebody can do is exercise, as far as stress relief itself.
So if you were making recommendations for me, your average everyday person, on starting an exercise program, or what type of exercise would actually be good for my heart health and decreasing my stress and overall making me a happy, balanced person?
So let's go over what basically they recommend from the sort of the American College of Cardiology recommends 150 minutes of exercise a week, which is really a paltry amount. I mean, I think it works out to 22 minutes a day, but we roughly say maybe 30 minutes a day. The average American does not do that. And in fact, if you look at activity, I mean, ever since I grew up in the 70s, life has changed in so many ways, and that life is just so much more automatized. When you drive, you don't have a stick shift. In fact, you don't even have to turn the ignition. You push a button. You don't pull the window down by moving it with your arm. There's a button. You find the nearest parking spot, you park there and go. A lot of times you don't even drive, you call an Uber. So on and so forth. So life has just become a lot easier. I mean, I remember in the days when you'd have to walk 4 doors down to chat with somebody, but nowadays we email or we text. My daughter texts me from upstairs because she can't be bothered to walk downstairs and talk to me. So, but even that little flight of stairs down to where I am is a reasonable amount of activity, which we no longer have to do just because life has gotten so much easier. So, unfortunately, what's happened is even people that do the 30 minutes a day of exercise, much of their life otherwise has become very sedentary. And this is obviously not good from a heart perspective. I mean, humans, we will generally do the least that we have to. We're not exceptional in this. If you look at, humans obviously are apes. If you look at other apes, I mean, yes, they fight each other or have sex or hunt, so on and so forth. But most of the time, if you look at apes, they're just sitting around. That's what we are sort of programmed to do, is once we have food, we just mostly sit around. But I think, unfortunately, life has become so automatized that we have to make an effort to exercise. If you look historically, hunter-gatherers, and there's still a few hunter-gatherers on the planet, few and far between, but perhaps in the Kalahari, in the Amazon, if you look at them, they exercise, they run and walk, and they do this all their life. And they do it for roughly about 2 hours a day until they have enough food to eat. So that's what we humans have done for hundreds of thousands of years, and in the past 50 or maybe 100 years, when food has become so plentiful that we don't have to farm and we just buy it, and we don't even have to go to the store anymore. The food can be delivered to the house. So we have become more and more sedentary, and we are becoming fatter and fatter. We're not the fattest nation on earth, but we're certainly one of the fattest. I think some of the Arab nations are the fattest nations now. But we are becoming fatter and fatter. I think that the young generation will be the first generation who will live less than their parents now in the US. And this is because of the chronic diseases that have become commonplace now. Almost so much of the population now has diabetes, and the diabetes really is just a factor of the sedentary lifestyle that we lead. I'll give you an example. So I think they're called the Pima Indians. So there's a group of Indians who live on the border of, I think it's Arizona, New Mexico, and Mexico, and these people are genetically identical. If you look at the ones that live in the US, they have something like a 70% diabetes rate, and some horrid number in the range of maybe 10% or so have renal failure just from such horrible diabetes. They lead sedentary lives. If you look at their cousins who live across the border in Mexico, who walk down the canyons to gather water and get food, so on and so forth, there is no diabetes. they live much healthier lives just because they do so much work. So unfortunately, this is something that we've taken out of the equation for us, and it's to our detriment. And we pay thousands of dollars for diabetes medicines and blood pressure medicines and cholesterol medicines, so on and so forth, to obviate these problems, but all they really do is delay them. So I think that it's important for everyone to have exercise as a regular part of their regimen, and it goes right along with their medications and the diet that they consume. So what do I recommend as far as exercise for people to keep them healthy? So I think that the 150 minutes a week is a good starting point, but I really do think that because we're so sedentary, that people should aim to do more exercise than that. I think that the simple things that they can do is such as learning to take the stairs, avoid the elevator, avoid the escalator. Now, from a public health perspective, I know certainly in Canada they're doing this, is they're putting stairs more accessible in department stores, in malls, so that people can use the stairs, putting the elevator in the corner of the mall. Things like this, having walking spaces in malls, having walking spaces in places where people go shopping, so that you don't end up driving from one grocery store to, the other store, which is really a short hop, making it easier to walk. If you look at the large major cities such as London and New York and Boston, where people take public transportation, there's a lot more walking involved, because you get off the train and you have to walk to your work or to the coffee shop, so on and so forth. Unfortunately, here in Southern California, we are absolutely bound by cars, and there's parking lots everywhere. So I think there's some things that can be done from a public health perspective to help people along. But what can we do as a people to allow us to exercise? Well, we doctors, every time the patient comes in, we encourage them to walk and say, you have to walk 30 minutes a day, or you have to do. But I think that the real way to change people's regimens, and behavior is very difficult to change as a whole. People are very resistant to change their behavior. However, the flip side of that is that once you do change somebody's behavior, or here let's call it habit, then it can be long lasting. And then it takes much less effort. So what you have to do essentially is take the sort of the friction out from the behavior that you want to. So if somebody says, well, I'm going to start going to the gym, the problem is, is the gym out of the way, or is it close to their home? And they've actually done studies on this. People who live close to a gym go far more often than people who live far away from the gym, just because it's there's a friction. If the gym is on the way to home from work, the likelihood of showing up is far greater. The other real big one is people who do exercise with a partner are far more likely to show up. Because if it's just you on your own, you're more likely to just say, well, maybe say I'll just take the day off. So I think that the biggest thing with exercise is really developing that habit and taking away the frictions from that habit. So the example that I generally give my patients is, do you take your pills? And invariably most of them do. But if you ask them about their pills, they'll tell you about their habit. They'll say, well, I keep my pills right by my toothbrush, because that way they sort of remember. In fact, they don't even have to remember. It's just sort of what they do. It's their habit. So my recommendation is, as far as exercise, is find something that you can do easily. And so for most people, I think that walking is really the best one, because there's nothing else needed. You can just sort of leave the house and go for a walk and go for half an hour. And walking is good exercise. I mean, I think if you can run, even better. But walking is very good, and make a time for it so that it's your habit. So for example, I don't know, every day after breakfast or something like that. And we're really asking only for half an hour a day. I mean, that's not a lot. That's like, watching the news, which is mostly useless, and in fact adds to stress. I recommend against watching the news. But you could basically supplant one thing for another, or perhaps when the news comes on, you know that it's time for you to exercise. If you already have the habit of exercise, I think that's great. So some people like to surf, and surfing is actually, if you ask the surfers, it's actually a social thing. They text each other, they know when they're going out, they know when the waves are coming, so on and so forth, and they meet their friends. And humans are social animals, and they will do it. Or people who play tennis, their tennis game is at a certain time, they have to show up, their friend's going to be there. If they don't show up, their friend can't play. So I think that with exercise, the most important thing is take out the frictions, take out the things that will stop you from going. So if your day is variable, if some days you're off at 6, some days you're off at 8, probably at the end of the day it's just not going to work for you, because you're going to come home and you're going to want to eat. Perhaps the time to do it would be the morning, or I've seen it in my office that if you look outside the office at lunchtime, a lot of the nursing staff are going for walks. You know, they have an hour off, doesn't take an hour to eat, so you can certainly go for a walk. So if that's a good time for you, you know, here we have nice weather almost every day, so lunchtime is a good time too. As far as I think that the most important thing from a heart healthy perspective is the so-called cardiovascular exercise, so walking or running or so on and so forth. But of course other resistance training is of course important, particularly as we age. We all lose muscle mass. But some people obviate that with carrying small weights in their hands, or wristbands which are 2 pounds or 5 pounds, and when they walk they do a little upper extremity exercise, so those are definitely helpful. Something of that caliber.
Excellent. That's my favorite, is to go for a walk. I love the fresh air and the sunshine. I say it heals my body, my mind, and my soul. And it's good therapy if you have a friend along with you. Any other last comments you want to share with us today, and other than just to get people out there in the sunshine on the street doing their walks?
I think the old Chinese saying, "The journey of 1,000 miles starts with one step," is just do it. Just pick a day and say, on this day I'm going to start walking, and all you need is a pair of shoes, really. And if you can find other things to do, signing up at the gym or getting a personal trainer, so on and so forth, or planning on this, that, and the other, plans just don't come to fruition. You just really have to sort of find something that's simple to do. And exercise is good for you. I exercise myself regularly. It's good for you in so many ways. Besides your cardiovascular health, it clearly has an effect on the chemistry of the mind. If people got out a little bit more, they'd really be happier people. I really recommend it. I think it's from a biological perspective, it is as important as the food that we eat. It's as important as the pills that you take. There's a lot more data on the benefits of exercise for cardiovascular health than there is on cholesterol drugs. That's a fact, and yet we give people medications all the time. Now, one does not supplant the other. If you have high cholesterol, you should take your cholesterol medications. Adding exercise will benefit it further. I don't want to confuse patients on that, because a lot of patients think that they can if they exercise, they don't have to do anything else. No, that's not how it works. Exercise is of course one part of it. But I think the important thing is making a decision and making it a habit. Once it becomes a habit, then it's actually difficult not to exercise. It's like a habit as far as food. You try giving a vegan meat. They just don't want to eat it because they're so used to eating vegetables. That's their habit. So my recommendations as far as these is do what you can. Certainly there's in fact even good data. Even exercise once a week is of clear benefit. If you only go for a walk once a week, even that is very good. But if you can, to make it a habit, do it every day.
Whether I feel like it or not, I do it every day.